Here is what we have coming up on this VA News. 2 spinal cord injury experts won prestigious Service to America medals to take home to the Bronx VA Medical Center.
VA celebrated the National Center for Minority Veterans' 20th anniversary.
Do you know Bob? Yeah, that Bob. Robert A. McDonald, the current and relatively new Secretary of Veterans Affairs.
Hello, I'm Clifton Coates Sr. with the VA Learning University.
And I'm Ann Chapieski with the Media Services Division in the Office of Administration. This is VA News. VA employees have had good fortune over the past 11 years after becoming finalists in the Samuel J. Hyman Service to America Medals Competition, commonly known as the Sammys. If they were finalists, they won their respective categories. And that happened again this year as Dr. William Bauman and Ann Spungen of the James J. Peters VA Medical Center in the Bronx received the Sammy in the 2014 Science and Environment Medal category. They are among 7 VA employees to receive a Sammy Award since 2002. Dr. Bauman is the director and Ms. Spungen the associate director of the National Center of Excellence for the Medical Consequences of Spinal Cord Injury. VA Secretary Robert McDonald was at the awards dinner to see the pair accept the award and plans to highlight their work and award in the recruitment of new healthcare professionals to VA. Here is a video from the Partnership for Public Service, which presents the Sammys each year to celebrate excellence in federal civil service.
I grew up in a family of 2 physicians, and my father had the incredible opportunity to work here at this institution. From my earliest days, my father would tell me how great the research was at the Bronx VA. One of the primary missions is to provide the highest quality biomedical investigation to improve the health and well-being of veterans, and by doing so, all Americans.
I share the responsibility with Dr. Bauman to help the center find the best way to improve the medical care, health care, and quality of life of people living with spinal cord injury. In 2010, there was Dr. Amit Gopher is an engineer out of Israel. He's actually a person with tetraplegia himself. And he had contacted Dr. Bauman to say he has this new exoskeleton called the ReWalk that he wanted to come and show us. And I was completely skeptical. The person that the company brought to walk in the device, I was told was a paraplegic. But I just see this person walking into the ward downstairs to the community day room in this device. I'm told he's a paraplegic, and I'm convinced it's a hoax. But, you know, he walked up and down the halls, and I turned to Dr. Bauman and I said, we're doing this. We have to find out if this is going to help the veterans with spinal cord injury.
The technology for the robotic exoskeleton is game-changing. It is something that permits an individual who has been seated in a wheelchair to stand and to walk. And if you have been injured and you have been unable to stand eye to eye with your fellow human beings, and you can stand up, and then you can miraculously appear to walk, it is an incredibly uplifting experience. We have observed that being up in an exoskeleton makes the gut work again, which is truly remarkable.
And until there's a cure for spinal cord injury, this is probably their biggest hope for being able to walk over ground, for potentially walking down a sidewalk or in a mall, or going to a park with their children even.
There is something special about being afforded the opportunity to broadly assist others. I was taught that if I could contribute to improve the lives of others, provide innovative care, and reduce suffering, then it is a privilege to do so. Federal service allows you to do so in a grand manner.
VA's National Center for Minority Veterans is 20 years old. Secretary McDonald and past and current leaders of the center were at VA Central Office on September the 24th to celebrate the center and its positive impact on the lives and well-being of minority veterans.
The center serves in an advisory capacity to the Secretary of the Department to make sure that any needs of minority veterans are quickly identified, to make sure that any gaps in services are addressed.
If you haven't met new VA Secretary Robert McDonald, then you may not know that he wants you to call him Bob. That's right. The Secretary of a cabinet-level agency wants to be addressed by not just his first name, but by his nickname since birth.
He continues to correct VA employees, veterans, and anyone else who calls him anything other than Bob, as he did Ray Liel and others in the VA news crew that interviewed him in his office in September. Here's a clip from that interview.
I joke with folks that I was named Bob when I was born. I'm Bob now as secretary, and I'll be Bob after I'm done being secretary. But while that sounds more of a joke or a little bit trite, there's really a serious purpose behind it. I think one of the things that we've got to do as an organization is we've got to get better communications from the top to the bottom of the organization. We've got to engage everyone in the organization, whether they're union member employees, GS employees, SES employees, Title 38 employees. Everybody's on the same team, everybody's got the same dream. And we've got to work together like a family. We've got to be able to tell each other when things are going wrong and when things are going right. We have to be able to admit ourselves when things are going wrong and not have a fear of reprisal or some other thing. I want everybody to be a whistleblower. I don't think you need to fit the legal definition of a whistleblower, but I want everybody every day to feel responsibility for improving the way we serve veterans. We should look at everything we do from the lens of the veteran, and if something's not going right, we should change it. I often tell employees of Veterans Affairs that my organization model is different than others. Typically, an organization model is thought to be hierarchical. It's thought to be a pyramid, and typically the CEO or the secretary in this case would be on top, and the lower ranking employees would be the ones that interface with the veteran. Well, in a service organization like ours, where we're serving veterans every single day, that's our only reason for being, we really should invert that pyramid. And the pyramid should be inverted where the broad part is at the top and the apex is at the bottom. And the person at the bottom is me, the secretary, trying to help those people who are facing the veteran. So it's the people facing the veteran every single day, providing service to those veterans, that are the most critically important people in the organization. And that's why I think being on a first name basis makes us more like family, gives us empathy for that veteran, and will allow us to work together with one dream as one team and one family.
The entire interview is now on VA social media sites. The Secretary also graces the cover of the next Vanguard magazine, which includes the print version of the interview. This is the 50th year since the onset of the Vietnam War. Producers of The American Veteran marked the occasion in 3 stories within episode 1005 to pay tribute to the memory of all the men and women who served during the Vietnam War era. Here's one of those 3 stories.
I always thought I was invincible and nothing would ever happen. But the first time I was wounded, I peed in my pants. I was scared, didn't think it could happen. I went out with the unit. There were some minor skirmishes. We captured some prisoners and I elected to take them home back to Pleiku. Then while I was back in Pleiku, the next morning my sergeant major came in and said, "Sir, the unit is being hit very heavy. You may want to go and check on it." The supply officer for the C team came running out. His name was Paul Hess, just a young first lieutenant. And he said, "Can I go with you?" And he said, "I'll ride just for the ride." I said, "Sure." So he took his weapon and he jumped in next to the gunner. The gunner on the right side was a staff sergeant by the name of Leonard, and he was going home. His tour was over. He was leaving that day. So we flew back out to the dry lake bed on the Cambodian border where we had taken off the day before. All hell broke loose, and Leonard and Hess were killed immediately at 51 caliber. The lieutenant was wounded. The gunner on the other side went right through that soft-skinned Huey, and Al Cartwright turned and said, "Clyde, somebody's got to get out." He says, "We're going down." So I said, "I guess that means me," because he was flying. So I jumped out, and Hess's weapon fell out of the aircraft by that time on the ground, and I picked it up, and I started running towards the woods. And I said, "Whoops, wrong colored uniforms are coming out of that woods towards me." And they threw a grenade and got me in the chest and legs. And I laid there for a couple hours, bleeding profusely, scared and bloody. Basically, my guys by that time saw what was happening, came down, and to hear them talking was the sweetest words I had heard in a long time. And they got me back to our lines. And I would say that was probably the biggest fight of my life.
Did you know? 4 VA inpatient programs exist to help veterans overcome some of the symptoms associated with PTSD. They are called Specialized Inpatient PTSD Units, or SIPUs. They are located in Topeka, Kansas, Salem, Virginia, Northampton, Massachusetts, and this one visited by our videographer, Jay Rosenfelder, in Salisbury, North Carolina.
I was a United States Marine from '99 to 2003.
I served the United States, and I was served with the Rangers.
SIPU is a 6-week inpatient PTSD program for combat veterans. We take 20 combat veterans every 6 weeks, and it's an intensive trauma processing program.
I've been in counseling at my home VA, which is in Murfreesboro, Tennessee, and both my individual and marriage counselors have worked at this program here in Salisbury before, and they kind of got together and decided that this would be a good fit for me and asked me if I would be willing to go.
We're not just doing your traditional therapy that most people probably have heard about. We're also doing things like Tai Chi, yoga. We offer equine therapy, where we take veterans to a local horse farm where they work on body language and communication. In addition to coping skills like anger management, relationship skills, they are doing intensive trauma processing where they write about and talk about their trauma from their deployment.
You go to a one-on-one counselor, you're probably in there probably 2 hours, and they don't have the scope that they got here. I mean, I'm talking, they got different POIs here. We do a little ABC training here to help you identify your problem. And then it identifies, what may be causing the stress to you, and then how can we go about attacking that or changing or thinking of a different way.
We also do a lot of exercise up here. Of course, we're managing their medication. We're incorporating their family when they're close enough to travel here, of course. We have a PTSD therapy dog. So it's just a holistic program to work with veterans on their combat PTSD issues and readjusting.
It's real good to be back around veterans, other veterans. Feel like I'm making some friends who I'll probably keep in contact for life.
Sometimes you feel like you're alone in what you're going through, and then when you hear one of your peers over there kind of experiencing some of the same things a little bit, and something you don't feel like that long range anymore, and it kind of gives you a little bit of safety that I'm among other people like me, and I'm not that different anymore.
That's all for this episode of VA News. I'm Clifton Coates. We're glad you could tune in.
And I'm Ann Chapieski. Have a really nice day and the rest of your week.